So I want to show you how to look at a possible tibial torsion and how that's going to impact someone's squat stance to make it more individual. So here's how I start. I've got Haley sitting back. I tell people to sit down like you're sitting at the beach. Want to make sure that her legs are relaxed so she's not going to flex her quads at all. And what I'm going to do is I'm going to grab this little sort of clamp here, thumb and index finger on each side of her patella. And then I'm going to take my thumb and go right to the top of her shin or her tibial tuberosity. And then I want to draw this sort of imaginary line through the middle of my fingers. And you notice here that that thumb is more towards the outside here, or the lateral portion. So when I say ideally, it doesn't mean that there's a dysfunction going on, but ideally we want that thumb dead center, right? There's always going to be little deviations, but that's, you know, a good bit close to the side there. So again, thumb on the tibial tuberosity, I can sort of flip it back and forth to make sure I'm on the middle, and I want to find that patella. Now that's on her right side. Let's take a look at on her left side. So same thing, I'll grab the patella, tibial tuberosity, and if I draw an imaginary line, you can see this one is a lot more medial when I draw that imaginary line than this one is. And you had some injury, past injury to this one too, right?
Correct.
Okay, so does that necessarily mean there's guaranteed going to be pain? No, it's just something that I want to identify to see how this impacts their squat stance. And in Haley, it does. We want to now flip Haley over. She's going to be relaxed, and all I'm going to do to sort of identify if there's a tibial torsion or not, keeping her relaxed, I'll just flex her knee to 90 degrees. I have her knees roughly hip width apart, and then we'll just have her flex her toes or ankles to the knees or dorsiflex. So what I'm looking at here is the angle of the foot relative to the thigh. So this is slightly turned out, but nothing major. Now let's take a look at the other side. This was the knee that was a little bit more medial. So if we keep this in line with her hip and then have her flex her foot, we can see this foot's going out. So what I'm doing is I'm looking at the angle of the foot relative to the angle of the femur. So if I drew a straight line from the femur would be going this way, whereas the angle of the foot is going that way. So we've got here to here. So it looks like there's potentially a tibial torsion on this side. So now we'll talk about how that should impact her squat stance. So what that means when we see a slight tibial torsion is that for Haley, on her right side, which is where we saw that toe turned out more, that in order to keep this neutral here is not necessarily keeping this knee in line with her second toe as she squats. So Haley, go ahead and take your ideal squat stance, hands out like a zombie, and then just go ahead and squat down and hold. So in this case, this toe on her right side may be turned out slightly more, and it may appear that this knee is going slightly medial because it's more over the big toe, but relative to what's happening at her patellofemoral joint, we could call that fairly neutral. And then stand up. Because it's that tibia that's slightly turned out. Whereas if I forced her knee on this side to try to stay in line with that second toe, that may be slightly uncomfortable for her because it's going against her structure. Now don't validate me on this one just to make me feel good, Haley, but is that actually the case? Do you feel like that toe tends to want to go out a little bit more when you squat?
Very much, yeah.
Yeah, so that's something that you tend to do naturally, right? Exactly right. So what you want to do is just sort of watch when somebody's squatting, and if you tend to see that they look fairly strong, but it's not necessarily a valgus that's happening, which is a roll in. Everything looks good, but it looks like that knee just wants to go in a slightly different direction more immediately than the toes. You want to then check to see if it may be a tibial torsion, maybe bilateral or maybe unilateral, and then you accommodate for it in the squat stance.